Hi everyone, my name is Roy Film, and today I'll be interviewing Laurie Devaney for the role of nominating committee member. We have just a few questions for you, and the first question is just to please tell us about yourself and your professional background, and when you do so, just please be sure to include any clinical and academic roles you've held, as well as association roles and participation within AOMT or other large organizations.
Okay, sure. Thanks, Roy, and thanks for the opportunity to talk to folks within AOMT. Well, right now I'm an assistant professor in residence in the UConn DPT program, and I've been primarily academic in that role for about the past 8 years. Last year I completed my PhD in exercise science, so now I'm kind of expanding into a little bit more of a research role. And my interests lie in how spinal mobility and the central nervous system kind of influences performance and injury in overhead athletes. So my area of interest has always been clinically in the neck, and so this kind of has allowed me to kind of take that one step further, which has been nice. But most of my career has really been clinical, though. I practiced for nearly 25 years before moving into the full-time academic realm, and primarily my clinical experience has to do with outpatient orthopedics. I'm also a certified athletic trainer, though, so have experience working with athletes, and in fact, my current clinical practice is as a consultant at UConn Athletics. Along the way, though, I've had some interesting opportunities to work with patients with chronic wounds, pelvic floor conditions, and osteoporosis, and interestingly, I've been able to find a role for manual therapy in all those kinds of patients. I've been a fellow with AOMT since 2007, something I'm very proud of. And shortly after I became a fellow, I was lucky enough to have the opportunity to chair the Professional Development Committee for 2 terms. I was also a member of the AOMT task force that recently revised the description of advanced specialty practice. And currently, I am chairing the subcommittee focused on leadership development within AOMT. Something I've really focused on in my role as an educator is exposing our UConn students to AOMT. This is something I'm pretty passionate about. Because year after year, I found it really proves to be kind of a life-altering experience for our students. So that's something I've really tried to do within AOMT every year and try to steer them toward that student SIG as well. So additionally, when it was still the orthopedic section, I was a member of the working group that wrote the 2017 neck pain revision of the clinical practice guidelines. And at the state level, I've been on the Connecticut chapter's education fund board of directors and been involved in helping to formulate some of our policy statements when it comes to things like concussion and dry needling within our state practice.
Thanks very much. Second question. What is your vision for AOMT if you're elected to the nominating committee? And by that, we mean what would you like to accomplish during your service, and how would you go about achieving that?
Well, I think AOMT's on a great trajectory, and I've always viewed AOMT as a changing force within our profession with a really strong moral compass at its core. And so that said, I'd really like to see our organization take a frontline role in reducing health disparities with respect to musculoskeletal care. In February, I was joined by 12 other AOMT members in writing a letter to the AOMT executive requesting that they open a conversation about the role of AOMT and what we can do and what our role can be in reducing health disparities within the mission of the Academy. And, while the primary mission of AOMT is and should remain very clear, I think that within that mission, increasing awareness of health disparities through education programming, promoting opportunities for and recruitment of minority students, support of current minority AOMT members and fellow members, and support for improving outcomes for at-risk populations through our research and education and practice all align really well with our mission and our collective vision, which is, as you know, a healthy world in motion free of musculoskeletal pain. Currently, not all Americans have access to the resources and to be included in that healthy world. So at this point, I think there's a need for more than just simply respect for diversity in order to try to heed the call of healthcare providers. And I think one of the things that allows health disparities to persist is a lack of minority representation in healthcare professions like physical therapy and in leadership positions within those fields in our organizations. So I feel this is something that could really be addressed as a member of the nominating committee, and kind of a couple of bullet points, in trying to propose that we would work with the membership committee to try to increase minority representation within our membership. identify barriers that AOMP members face in general in pursuing leadership roles, and in particular, our members who are in minority groups, and work with leadership development to address these barriers. And then also identify minority members within our membership for leadership roles within AOMP and associated organizations.
Thanks very much. And I've just got one more question for you. What's the best advice you've ever received?
Well, that's a tough question. I've had so many fantastic mentors along the way. And so, you know, I have to say that probably the person who had the most impression on my development as a physical therapy professional was Stanley Harris. In going through the University of St. Augustine Master of Science in Orthopedic Manual Therapy back in the late 90s, he really instilled in me a sense of professionalism and how important it was for PTs to present themselves as professionals in how we conduct ourselves, even in simple things as how we dress. And so I would say that that Stanley's advice to actually think like a professional in order to be a professional was really helpful in kind of taking my perspective of physical therapy and elevating it to the next level. And that's something that I try to pass on to my own students now, and I think that helps to develop their sense of identity as a physical therapist, and I think that's something that's really good for our profession.
Thank you so much for your time, and especially for your willingness to serve as a member of the nominating committee.
And thank you for asking.